Hi, everyone.
Hi, everybody.
Welcome back to the podcast.
Welcome back.
So we have an interesting topic for today that we'll dive into in a second, but unfortunately, our cat Mcat passed away.
Yeah, and we wanted to share that because we know we had mentioned in our last podcast that he was ill.
Yeah.
Yeah.
So it was definitely a emotional week at our house.
Yep.
Letting our kids know, different things of that nature. And, our kids are young, so they don't really understand much around death, except that he's just not here anymore.
Well, speaking of kids, you're right. Like, it is kind of interesting, like our experience of grief, and it's very heavy and it comes in waves. And obviously our kids experience it too, but they're very, like their concept of death is really different. So our daughter every day is like, Mcat's dead, and sings it along. And I think it's important for her to express that, but
she doesn't fully understand.
No, and it hits a bit hard when she says that. So it is interesting.
The other thing about Mcat is he just hated our kids.
No, yeah.
He loved us, but we got Mcat 7 years before we ever had kids.
Yes.
And so he was accustomed to little fingers not grabbing or poking at him.
Yeah. And our kids are the least connected with him out of all of our animals. So that is also interesting to see kind of their response.
Yeah, because the other two cats, they came along when we had kids. So they're used to it. Harry will that guy's got more patience than I do. He just
lies there while they poke at him.
Yeah. But Mcat would not do that.
No, he did not tolerate it.
Yeah.
So it is. We are definitely sad. And interestingly enough, that really aligns with our last two podcast episodes in terms of processing and releasing emotion.
Yeah, and I think that's what we mentioned last time is that release word we're careful to use because it's not one big cathartic release.
No, especially with grief.
Yeah. And, with issues in life that you can think about, never think about them again, it's much easier to have one release somatically, move through that emotion. But with things like grief, I definitely know it comes in waves, right?
Yeah, for sure.
So today, we also have a hard topic. We've had a string of these. We got to lighten it up a bit. Maybe next episode we'll lighten it up, but today is not that episode. So our topic, are you traumatized from your chronic pain or symptoms?
That's a pretty intense statement, Tanner.
And we have a special type of trauma that we talk about at our clinic and in our upcoming course, the Somatic Safety Method, that we're going to dive into today. But I think it's a really important thing to discuss.
Yeah.
Because there are so many misconceptions, and it makes sense that we have a high emotional charge, high dysregulation to the onset or progression of our chronic pain or symptoms.
Yes. And I think when I'm talking to people, I see that a lot. Like it really stands out for them when their symptoms started, the onset, maybe the confusion, the fear. Like it's so intense in the beginning, rightly so. But it makes sense that it would be very traumatic for people.
Yeah. And I think people get the misconception, and this isn't intentional, but, in pain reprocessing therapy, they talk a lot about learning to respond with ease and lightness and curiosity to symptoms.
Yeah.
And we want to get there.
Yes.
But you can't just skip over you having a trauma response to your symptoms.
Right.
And so, I really ask people, what was the response in your nervous system when your chronic pain or illness developed or progressed?
Right.
And, in our approach, we call this sensitization trauma.
Okay, so why sensitization trauma?
So we talk about central sensitization. When your nervous system is dysregulated enough over time, so you're in kind of survival mode, and we'll get into a breakdown of what this can look like. But when you're there long enough, your your nervous system, your brain, it starts to sensitize. And what that means is chronic pain and symptoms develop.
Yes.
And so sensitization trauma, I'll break this down. When we have that kind of onset progression of chronic symptoms, whatever it might be for someone, we experience sensitization trauma. So this is trauma stemming from the onset or progression or relapse, potentially, of chronic symptoms. And it results, as we're saying, from this chronic dysregulation in the nervous system. So I'll give a little story from my own healing, but this can look a couple of different ways.
Yes.
The first is it can look like this high sympathetic fight or flight response. So this is where people start to have like high anxiety, hypervigilance, agitation, anger, rage. Breathing becomes very dysregulated here. Heart rate is rapid.
And are you talking about this tenor as in coming on, like kind of the day, like the first day of symptoms, and they're in this, or is this a prolonged state? What is coming to your mind when you're talking about the trauma experience of symptoms?
So, when we talk about a trauma response being high sympathetic or shutdown, it's prolonged. So this isn't like you felt this for half an hour.
Right.
You maybe had a panic attack. After that, you felt light and at ease. That's not what we mean by a trauma response.
But we can validate that experience would still be very difficult. That
experience is very difficult. But when we're talking about sensitization trauma, it's like when the symptoms onset. And for some people, it's like the day they come on, they're so intense. But for other people, it just builds and builds as the symptoms kind of increase. As I experienced with mine, my symptoms were not that intense at first.
Right.
But, this progression.
Yes.
And so for some people, this sensitization trauma can look like this high sympathetic, anger, anxiety, hypervigilance. There's like intense fixing, hyper focus on the sensations, which is really common. Now, the other type of trauma response that can really take place, and this is very common. This is the most common type of trauma response that people experience, but it's less known, is that dorsal vagal response.
And why is this so common but maybe less known?
Because when we feel trapped, inescapable danger, we can't figure things out, and this makes sense for chronic pain and symptoms, that what happens in dorsal vagal is we start to become immobilized.
Yes.
And chronic pain and symptoms themselves do this. They immobilize us. But we're immobilized with a high sense of fear. So we're shut down, and we can go to places of despair, hopeless, helpless, numb, dissociative. We start to disconnect. And for a lot of people, when their symptoms first came on, but especially as they progress, they enter this kind of shutdown place.
Right. And what would that look like?
So I'll explain it in a second with my own journey. But I want to mention here, whether it's high sympathetic or low dorsal vagal, it doesn't necessarily need to be one or the other.
Right.
Like for some people, they're oscillating back and forth, like almost in like waves between the two.
Yeah.
But for some people, it's very fixated. And this will make more sense as I kind of share my own journey with this. But this is what we mean by sensitization trauma. When your symptoms came on, when they progressed, you had one of these responses or both of them.
Well, and I think it's important to for people to recognize this, because often, we might hear the word trauma and it's like, oh, I don't have any trauma. I there's nothing I can pinpoint. But often this is the traumatic experience for people. And it's important to recognize kind of how dysregulating this can be.
Yeah, because I think there's a lot of talk about like a traumatic event happening.
Yes.
And then symptoms starting.
And for some people that is the case, or trauma from childhood that is connected.
But this is almost, if you've had trauma in your past, this is like the next trauma that takes place for people. And we want to validate it. It makes sense.
Yeah.
Symptoms, when they come on, they're really scary.
Yeah.
We are confused. We're getting mixed messages from the medical system.
Right, which makes things even more scary.
Yeah, and at first in a person's journey with chronic pain and symptoms, you're relying fully on the medical system.
Yes.
Which could frankly not be being very nice to you.
Yeah.
And that might be putting it lightly. And you're fully reliant. So this hopeless, helpless feelings start to develop.
Yeah.
And that's what happened with myself. So when we talk about my own journey, at first it was more that sympathetic fight or flight.
Okay.
Like I was not instantly, because my pain started in my right knee, but as it started to spread to other areas, I became more hyper-focused, hyper-vigilant. There was this revving up that took place, which you probably experienced for me.
Yeah.
And I was very much in the medical system trying to figure this out. Yes. Sending specialist to specialist. No one's finding much. People are saying some things and then backtracking. There was a lot of confusion that built up. And at first, I think I was more in this like fight response. Like I was angry.
Yeah. And this determination almost to kind of figure it out, which makes sense. And that can be very useful at different times. And so we really think, okay, this is what I need and push further.
Yeah. So it was that like fight, I'm going to push through, I'm going to fix this, I'm going to figure it out. And then it was followed, maybe not perfectly sequentially, but by a high flight, like high anxious. I remember having panic attacks around this.
Do you remember why that started setting in for you, that flight?
As the symptoms were spreading and I had been trying to treat this medically and it wasn't getting better, it was getting worse. Yeah. And my body was becoming more and more immobilized. I got to this like anxious panic zone of I don't know what to do.
Yeah.
Everyone's confused of why this is happening to me. People are telling me this might be lifelong.
Yes.
So there was a high level of that flight, anxious energy that I started to experience. Now, there was a big turning point when my back pain started. And it started a little bit before this because I remember being hopeless, helpless, having some quite dark thoughts and discussing that with you. But when my back pain started, that was probably 2 years in. And it was so immobilizing and so intense that I just shut down into dorsal.
Right.
I shut down. I went numb. Yeah. I remember I'd still have moments of anxiety or rage, but they were fewer and far between. Like it was more so like I was numb, I was in despair, and I felt hopeless and helpless.
Yeah.
Because at that point, I'm 2 years in, nothing's being resolved. It's just getting worse.
Yeah.
And I had no solution. And so for anyone listening, I empathize because it makes sense that we get there.
Right. And it is like those responses are our nervous system and the body trying to kind of take care of the situation for us in this kind of way of protection. But it's not always working.
Yeah. And this is what we mean by trauma being stored in the body. All that energy, it doesn't just disappear the moment we find a mind-body approach and feel hope. Some of it might, but for a lot of us, that dysregulation has been built up in our body and nervous system for so long.
Right.
And it gets kind of trapped there.
Yes.
As Peter Levine talks about a lot, like trauma is stored in the body. It gets trapped in our nervous system.
Yes.
And so I think sometimes when people start to do things like somatic tracking, it's really hard because eventually, sure, we want to get to this light, easy curiosity, but we can't just skip over not processing everything that we've just gone through for, for me, it was only 3.5-ish years. Yep. For some people, it's been 20 years.
Well, and the idea of processing that can be very scary, of looking at that. And I think often people will tell me, oh, like this was my experience, but almost downplay the trauma part of it as well. Yeah. This idea that, well, this has been my life, or I shouldn't view it as trauma, or for whatever reason, maybe that's come from the medical system. Like I'm not sure. It can come from many areas.
I think so too. Yeah, I think there's, it drives me nuts in the sense that, our culture determines like what's appropriate to be traumatized by,
right?
And what's not. And that's not how we function. Like that's not how we function as human beings. Yeah. Like I've worked with people where objectively from the outside, the event seems very small.
Yes.
But the response in their body and nervous system was huge. And then they get invalidated by everyone, but it's totally valid. Like,
right. It's this idea that like, well, I shouldn't have responded this way. That's the whole I shoulda, shouldn't.
Yeah. And people get that with chronic pain and symptoms a lot, where they get this message of, oh, I shouldn't feel this way about this.
Right.
Or medical professionals telling them like, yeah, this happens to people. Not a big deal. Like maybe not that exact messaging, but that's what's being told to them.
Yeah.
And so then they have all this trauma, this sensitization trauma, and they feel like, oh, I shouldn't feel this way.
Right. And people don't even, and it becomes this difficulty to even recognize it as trauma.
Yeah.
Yeah.
Yeah. And we're explaining really generally here for anyone listening, but I think this is a common thing that happens. Now, sensitization trauma, it unfortunately perpetuates our chronic symptoms.
Yes. And so how does it do that?
So, in pain reprocessing therapy, they talk about the pain fear cycle. We call it like a sensitization cycle because we're including more of a nervous system lens on this.
Yeah.
But when you have chronic pain, chronic fatigue, any chronic symptom, and then you have this dysregulated response, it might be the sensitization trauma.
Yes.
Fight, flight, freeze, shutdown. Your thoughts, beliefs start to get skewed.
Right.
Difficult emotions increase. And then as a result, your brain and nervous systems feels more in danger, more in a state of survival.
Right.
And produces more symptoms.
Right.
And it just keeps that cycle going.
Yeah.
And that's why it's so essential that people find a therapist to process this with.
Right.
Yeah.
Right. And it doesn't I agree about a therapist, but just this idea of processing in some way. And a lot of people, by the time they come to me, they've been working on processing, but they need that extra piece of talking it through, that validation.
Yeah. Yeah, and it's, I've seen people do it on their own, and it worked great.
Yeah, and it is possible.
And if people are struggling, that's when it's time to reach out to support.
Yeah.
In our course, we talk a lot about sensitization trauma. We give a really laid out process with practices.
Well, in a lot of ways, we developed this course for people to kind of give it a shot of working through and doing the processing on their own.
Yeah.
But knowing that there's resources if they need it too.
Exactly.
Yeah.
And we've kind of talked about this, but I want to hammer this piece home to really validate everyone listening.
It's getting very intense here.
I just don't like the invalidating messages that people are given.
Yeah.
And so, why does sensitization trauma occur? Like we've said, you feel very dysregulated during the onset, progression, or relapse of symptoms. As you mentioned earlier, confusion, frustration, hopelessness, helplessness starts to occur as we try and figure it out.
Yes.
For lots of people, they're years into their journey before they come to a mind-body approach. And so they feel very hopeless and helpless because all the treatments they have no control over.
Right.
One of the great parts of the mind-body approach is we have control.
Yes.
Like the healing's somewhat in our hands.
Right. Yeah.
Which is, I found very empowering.
Yeah.
I found scary, don't get me wrong, but I found it very empowering in some degree. The impacts of fear and dysregulation from very scary or painful events also start to take place.
Yes.
So throughout your pain symptom journey, there's lots of these moments that were like incredibly terrifying or incredibly saddening. And that starts to escalate it too.
Yes.
Yeah.
Yeah. And sometimes there's no, in terms of processing or working through that or even understanding that, there's no understanding of that. And so then it's just moving on to the next day and they build and build and build.
Yes. And the last thing that I'll mention here is, and I really experienced this too, this is what really shot me into dorsal, is the significant reduction in ability to use your body or ability to live your life the way you want.
Right.
Because there is a lot of grief and loss associated with that. And, how we're viewed by others changes or how we believe we're viewed by others, either or. Yeah. That changes. And then there's grief and loss about that.
Yes.
And so for all these reasons, I really think it makes sense that a lot of people with chronic symptoms, chronic illness do have some sensitization trauma going on, if not quite a bit. And so, healing really involves the processing of this. And as we talked about this, we do this with our clients. We're doing this in our upcoming course. But, if people are struggling with some of the more basic techniques, and I love the basic techniques. You go on my YouTube channel, there's probably like 8 somatic trackings there. I'm a big component of it. But what I'll see people do is, they're trying to force themselves to be indifferent to their symptoms or to, change their behaviors, pretend like the symptoms aren't there or do somatic tracking. All of those are really useful. I use them all the time with clients. But if you're really struggling with that, it may be because you skipped over feeling all these difficult things, processing the dysregulation, because otherwise it's near impossible during somatic tracking to get to this light and easy place. If you have all this confusion, fear, frustration, fear, I said fear twice there, that's built up about the actual symptoms.
And I think that can be really scary. And we often want, and as we've talked about a lot, we often want to skip over difficult emotions, difficult memories. There's the fear of like, okay, if I approach that and process it, that, what am I going to feel? Are my symptoms going to get worse? And so it is understanding that part of working through trauma experiences is starting to move towards it in this safe way. And that often means discussing it or doing a somatic approach or.
Yeah. And so I hope this episode was helpful for people in understanding like, hey, this could be a roadblock for me. Because again, over time, we need to have a more regulated response. We need to have, a more calm response to our chronic pain and symptoms. That's how we break that pain fear cycle, the sensitization cycle. But don't skip over this.
No. And if you are listening and you're someone that like, okay, I have this, like we mentioned, there's people that are trained to kind of help support, process, or work through that. Obviously, we've mentioned our course a couple of times. And so there's tools to do that. And it doesn't mean you can't do the other work as well. But even having an awareness that there's this sensitization trauma and an understanding and kind of almost welcoming that a little bit and the emotions connected to that is important. So like grief throughout the recovery process, understanding that that's going to pop up is important to know.
Healing can be complex. And for some people, a very simple approach works very well. If that's not working for you, we got to get a little bit more complex. And that's okay. My healing was complex. So anyone listening, I relate to you there. So we thank you all for listening.
Thank you for listening.
And we'll talk to you next week.